Welcome to the Dental 18 podcast. We're your hosts, Kiera
and Dr. Mark Costas.
Mark and I had this crazy idea that maybe we could combine a dentist and a team member's perspective because let's face it, dentistry can be a challenging profession with those two perspectives. And Dental 18 podcast was created.
I'm a practicing dentist, a multiple practice owner, a dental performance coach, and the founder of the Dental Success Institute.
I've been a dental assistant, treatment coordinator, scheduler, biller, office manager, current practice owner, and international dental consultant. Mark and I don't just understand you, we are you.
Our goal is to positively impact the world of dentistry by sharing our lessons learned from the road in hundreds of dental offices.
Two perspectives, one mission, to help dental professionals reach their full potential. Welcome to the Dental 18 podcast. Hello, everyone, and welcome to another exciting episode of the Dental 18 podcast. I'm Kiera Dent, and today I have the one and only Mark Costas joining me. How are you, Mark?
I'm great, Kiera. How are you?
So good. I'm so excited to be podcasting with you, driving down the freeway. I am pulling a Mark Costas today, so, you know.
Are you sure this is going to be exciting?
It's totally going to be exciting because as long as I stay within the lines, I'm having an exciting time. So we'll see how everybody else feels today.
Well, I'm glad that we have your undivided attention today, Kiera.
Undivided. I'm just, this is what we do, Mark. I either will talk to you on the phone or we'll podcast. So one of the two.
What kind of rental car are you driving right now?
I'm doing a Nissan Rogue, the same one that we had when we were in Kentucky that I completely got stuck in the parking spot in. So
nice.
Yeah.
Nice. I like it. Those are high quality vehicles.
You know what I do appreciate about it? So I always feel so sad because I travel to these really cold climates, and this is totally first world problems here. But like a lot of the rental cars don't have heated seats, and I'm a total baby. So the fact that this one has heated seats because it legitimately snowed this morning in Sioux City, Iowa, and I woke up to just a full-on whiteout. So I was pretty excited about the heated seats. So I'll take it.
I'm kind of done with winter.
I know.
I'm ready to not be cold anymore.
Right. We'll thaw out soon enough. It's only April. No, 'tis the season to snow, apparently. So
yeah, it's like you get those little morsels, those little tasty nuggets of like 85-degree weather when you're in the warm.
I know,
warm
like
weather
this
states.
last weekend.
It was 86 degrees during the day in Scottsdale.
Such a dream. And now, welcome to a whiteout winter day. I packed for summer on this trip. I'm in a little dress, no tights. It was fantastic.
Yeah, that is your optimistic nature, Kiera. It's really going to be warm if I don't pack winter clothes.
Exactly. So anyway, it was a fun day in the office, and I realized today, Mark, if you're on board, I think we should do a podcast specifically dedicated to dental assistants because I sometimes feel my dental assistant crew out there gets a little left out. I don't feel like there's as much information, so I wanted to do a podcast for the dental assistants if you're on board with that today.
I would love to talk to dental assistants. In fact, for many, many years, I've been teaching dental assistants, so I kind of feel like I understand their jam. You know what I mean?
Yeah, I do. You have the dental assisting school. I love the dental assistants. That's where I started. So I thought, let's do a podcast specifically for dental assistants and give some shout outs to those amazing team players that I believe have one of the hardest jobs in a dental practice, but they can be one of the key pieces in a dental practice through and through.
Oh my gosh, I totally agree. I rely on my chairside assistants so much. And when I get one that I'm used to, you talked about this earlier, and they can anticipate your every move. They know exactly kind of what you're thinking. Like we can be talking or chatting and be doing the most elaborate intricate surgery and not a word needs to be spoken about the procedure. We just can kind of, it's like a dance.
It is.
It's like you anticipate the person's next move. You know exactly what they're going to do. You know exactly what position to hold it in. It's a very, very unique relationship that doctors have with their chairside assistants for sure.
It's amazing. And as the assistant, I remember those days were like my favorite days when I could anticipate my doctor. Whenever I switched to a different job and I had to try and learn the new doctor's style, it was a rough go because I wanted to be that assistant that could anticipate your move, that was 3 steps ahead of you, that made the patients laugh and made my doctor's life so easy because I'm keeping the patient happy. You just go in and crank out dentistry and do a fantastic job, and I'm taking care of everything else. Like, as a dental assistant, that was where I felt like you are at the tippy top of who you should be as a dental assistant. So I'm glad that.
Yeah, and plus the fact that in most cases, the dental assistant spends the majority of the time with the patient. So the same goes from the hygiene department, right?
Yes, exactly. The doctors don't get in
15,
there that
20 minutes and does his periodic exam. But yeah, I mean, the X's and slashes is a perfect example of that. You open my eyes to that. It's like, oh my gosh, look at how much more time the chairside assistant is spending with the patient than the actual doctor is with the X's and slashes. It's like we come in for 3 minutes, anesthetize, then leave for another 10, come back for another 30, and then leave for the rest of the appointment. So we're in there for like 33 minutes on an hour-long procedure, and the chairside assistant is there the entire time. They never leave.
Mm-hmm. Mm-hmm. Right. And that's where I feel like, okay, let's give some tangibles. I wanted to hear, I know what, for me, being a dental assistant, I felt I was the very best at, but I wanted to hear from a doctor's side of view what you look for in your dream dental assistants and how the dental assistants can really elevate to a higher level. Because I know there were times that I got bored as a dental assistant. I had mastered what I needed to do to know every single step. And so if you're in that position, I wanted to also highlight some things you can do to advance beyond just knowing the step by step. So we'll start first with Mark. What is the favorite things that you have of a dental assistant that you just, if this dental assistant had these 3 things, that's what you really look for. That's what makes your life as a doctor easier that dental assistants can do.
Yeah, I mean, it all comes down, just like any relationship I have in my life, I get along better with people that are self-aware and that have, high levels of emotional intelligence. So they know how to have a good conversation. And that for me is really important selfishly, because I like to have nice conversations all day, or else my day is a drag and it's boring all day
really
every day.
Is.
I like to have stimulating conversation with people, and I like for the dental assistants to be able to have that type of deep connection and ability to build rapport with our patients immediately. That is so important to me. So that's number one. That's like culture and ability to build rapport and communicate well. But from a clinical perspective, they just have to know their stuff, and they have to know their doctor. They have to know the preferred instrumentation that the doctor wants to use, because all doctors are totally different. Like, I use a ball burnisher, even though we don't even, pack amalgam. I love to use a ball burnisher to condense my composite, and I use like this specific elevator, and for lower anterior teeth, I use a specific forceps. For for a posterior maxillary molar, I use a specific instrument. So I like the assistants to know me backwards and forwards as far as my preferences. But then it goes to positioning. And we talk a lot about ergonomics in dentistry. I've had 2 back surgeries, so it's really important that I keep proper positioning and posture when I'm working clinically. But if you can minimize the amount of movement that you have, it speeds things up, not just, by a couple minutes here and there, but by a long shot. Like, if you can eliminate extraneous movements and get really, really precise about positioning of the instrument, exactly where in the doctor's hands you're going to be passing it to, exactly where you're going to hold it in front of the patient's chin versus over their chest. All those tiny little corrections all day, every day make for more fatigue and frustration, when just learning those tiny little nuances can be really, really important to that relationship and to that flow.
That was solid. I had never thought about, I always knew I wanted to have my instruments as close to the patient's chin as possible, and I wanted to make your life easier, but I didn't even think of how much that can fatigue you if my instruments aren't close enough when I pass them to you, if you're having to reach all day long to get those instruments, because I had never thought of that. So that was a a good thing for me to, I think it just was natural for me, but I never even paid attention to how much I can help you even not just get a procedure done well, but also sustain your longevity of being able to practice and not have back pain or neck pain or, hand pain, and really be able to even protect my doctor for longevity. That was something very insightful that I had never thought of. Thanks for that.
Of course. So if you can eliminate large sweeping movements from feet, say from 20 to 24 inches down to 2 to 3 inches, not only are you saving fatigue for the doctor, you're actually saving the back and the energy level and fatigue from the dental assistant as well. So positioning is everything. That all comes down to role playing and making sure that you verbalize your preferences from a doctor's perspective and put everybody in the exact right position. Eliminate any long sweeping movements, eliminate any extraneous movements, and get everything as tight as humanly possible. So you're talking about one movement versus 5, you know?
Mm-hmm. And I love that because we're all about efficiency. And as a dental assistant, you want your doctors to run on time. Those small little snippets of time to have those instruments closer to eliminate the reaching, which takes longer. It's so silly because I know it's a couple seconds here and there, but you compound that over an entire day, you're able to stay more on time, be more efficient, less fatigue for the dental assistant, less fatigue for the doctor, just in a simple positioning of the instruments to make sure you're both in the best place possible. And I really think doctors, I work with a lot of doctors, and I feel like a lot of them tell me that they're uncomfortable telling the dental assistant what they want. But I will tell you, doctors, my job as a dental assistant is to make your life easier. And if you don't tell me what you want, if I'm passing instruments the wrong way, if I'm suctioning and I'm right in the way of your mirror, I can't see super well sometimes. And so doctors, don't be afraid to tell your assistants what you want. And like you said, Mark, to role play, I feel like that is so powerful as a dental assistant to be told that information, because end all be all, I feel most dental assistants feel a sense of pride and satisfaction when they can really be that assistant that their doctor relies on, that they love to work with. I always loved when I was the favorite assistant that my doctors just loved. Like, we could jam it out. It was so fun. We were laughing the whole time, and we were able to get through procedures really quickly because we were so in sync with each other. So give the feedback to your dental assistants. Most of them that I've met really want to make their doctors happy. And I feel doctors just let them know so they can really help you out.
Totally. Yes.
Okay, beautiful. So those are some good tacticals, Mark. I appreciate that. So dental assistants, if you're listening, tell your other friends, but those are 3 big things to look at. Go and check yourself. I know sometimes I feel like I'm just a rock star dental assistant, and I don't look to see, am I passing my instruments close? How could I tighten this up? And ask my doctor for feedback, so that way I can really be the best asset to the practice and to my doctor. So dental assistants, there's your challenge for the day.
Love it. Good
Love
job,
it.
K-Dog.
Okay, I want to go one step further, though, because the dental assistants get left behind. And, some of them might be listening thinking, okay, fantastic, you guys. I do this all the time. What can I do to expand as a dental assistant beyond just passing instruments, setting up a room? And I kind of wanted to dive into that, if you're on board with that, Mark.
Oh, I have so much. I have so much more, Kiera, when it comes to chairside assistants. You just let me know where you want me to stop.
Go. I want you to start. Start now. Unleash the flood. Let it roll.
The first one, I talked about communication, because communication's, the most important thing when it comes to working hand in hand with somebody all day, every day. An open line of communication and being able to verbalize your expectations. And so the dental assistant knows what success looks like in the doctor's eyes, and the doctor knows what success looks like in the dental assistant's eyes, and it should be the same. You guys should have the same goal, and that's patient comfort, exceptional clinical care, speed, and potentially being able to be spontaneous and pick things up when necessary, those sorts of things. But a big word that I use often, Kiera, and you're probably sick and tired of hearing me say that, and that is calibration. You have to get so calibrated with your dental assistant as far as the way that you communicate with people. So dental assistants, this is a subtle thing, but when you hear the doctor over and over again explain the progression of periodontal disease, or why amalgams eventually fracture marginal ridges, or why a patient has an infection or an abscess, or why a tooth needs to be extracted if there's bone loss. All of those little things that the doctor is explaining all day, every day in front of you, I want to challenge all of you dental assistants to calibrate your language with that doctor. So if the doctor's not there, you should be able to explain it the exact same way as the doctor, over and over again, all day, every day. So if the doctor says, that for a particular crown, say for instance, the doctor believes, because Gordon Christensen says so, the godfather of prosthodontists, says that you should always crown a tooth if there's a stress fracture and the restorative material extends beyond 50% of the occlusal surface. If that's how the doctor explains it, you want to be able to explain that, calibrate that language, but also be able to explain it in layman's terms, because a lot of times the doctor is very scientific and they'll be able to say that, but you want to be able to say the same exact thing and then say, okay, from you, Mrs. Jones, what that means is. So be able to calibrate your language, but take it one step further and be able to put it in patient-friendly language as well.
So true. And I love this so much, Mark, because I was in an office today and it's been a transitional office. So this assistant has worked with the retiring doctor for about 8 years. New doctor has come in. And the reality is every doctor explains procedures differently. Every single doctor, and I'm going to explain a procedure differently. But like you said, Mark, the more calibrated you are, the easier it is for a patient to understand why they need treatment and to be able to say yes to getting treatment done. And I don't think dental assistants realize how impactful they can be in helping patients with case acceptance by being calibrated, by not confusing them, by backing up your doctor, by saying the same things that they just said, and you're totally standing on their team, telling the patient exactly what they just heard from the doctor. But like you said, Mark, I know from personal experience, patients look at me and say, so what exactly do I need to have happen? Like what is going on? And being able to explain it to them where they understand. I remember there was one time I had a patient who came afterwards and thanked me as the dental assistant and said, Kiera, I had no clue what a buildup was, and you made it make sense. I understood exactly why I needed to get the treatment done, and they went through with the treatment. And I feel dental assistants have a very powerful role in this, or they actually can sabotage if they're not careful. Like if you don't watch the words you're using, you can totally unravel what the doctor just put into place by not saying the same things they say, by like not supporting your doctor or saying things even subtly and not realizing, to making the patient's question, do I really need this crown? Do I really need this root canal? So backing your doctor 100% and being calibrated. Mark, that was solid nuggets coming from you today. You're rolling them out left and right. Keep going. I want to hear more.
I had an extra cup of coffee. What can I say?
It's coffee with K-Dog in the afternoon. Perfect.
Yeah. I mean, we have this this sheet. If you can imagine, I saw this picture of you on online today, on Facebook today, of you laminating, you being the crazy laminator, like creating these checklists and sitting up front at somebody's office laminating stuff. One of our clients posted that on one of our
I didn't know that was out there, but I definitely was doing that.
I thought it was hilarious. And we use a laminator like crazy, but when another like just little subtle tip. I'm just throwing these things out. I have a zillion of them, but I'm just throwing these things out.
I love it so much. Keep it coming.
So if the doctor, for whatever reason, gets frustrated and is very particular for whatever reason,
because they're a dentist, all dentists are. That's why.
Because we're left brain, and we're anal, and we're detail oriented. Let's just call it that.
That's great. We like it. We're not judging at all. So go on.
Yeah, thanks for not being judgy. So, so if the doctor walks into the room and they're like giving you a funny look because the rheostat has a smudge on it, or the chair isn't elevated up and that's what he's used to, or you have the wrong setup out, or whatever it happens to be, and you're constantly having these I guess, conflicts with your doctor. That's the best word I could think of right now. But I think that you guys need to get together and make sure that he expresses to you exactly what he wants the room to look like. So take 5 minutes and say, hey, doc, I want to be the best dental assistant that I could possibly be for you. I want to have the room set up exactly the way you want it to be. And I want to say the exact right things to the patient before you walk in. Can we go over some things just so I can be a more efficient and better dental assistant for you to be able to make sure that our mornings and our afternoons run more smoothly? So what we did was we created these checklists, right? So the doctor and the assistants would sit down and say, the doctor would say, I really don't like it when there's dust on the inside of the glass for the overhead light. Okay, that's good to know, because a lot of times the dental assistant will wipe the outside of it and there's dust on the inside. Or I really don't like it when, let's say the caboodle, we call it a caboodle, like when the composite carrier is on that side of the room. I want it this side of the room, and I want these certain instruments laid out right in front of me on the tray. I want the Explorer and the mouth mirror hanging off the edge of the tray so I know exactly where it is in the lower right-hand corner. So all of those things, you can create a checklist for all of those things. And then when the doctor walks into the room, the checklist is face down on the countertop. And if anything is just out of order, he can kind of take a look at it. And if you checked it, then you're responsible for that. So that is just another little tip. And you have to be sometimes, dental assistant, chairside assistant, has to be proactive about asking the doctor exactly what he wants. And it might take a little bit to refine your process and to get that checklist to be exactly the way that he wants it. But if you guys can calibrate correctly as far as that stuff goes too, it saves a lot of stress and a lot of conflict, because he has told you exactly what he wants. And if it's not on that checklist, then it's not your fault.
Yeah. And I love this because, Mark, when I was a dental assistant, I would say, dental assistants, if you go to your doctors, when you go to your doctors and ask them for this information, pay attention, listen. And when they tell you, write it down, make the checklist so you're not having to ask again and again. Because I found that a lot of doctors get frustrated when they're like, I've told my dental assistant 7 times that put the mouth mirror on the right side. And as dental assistants, I know sometimes I used to think, well, whatever, like it's a mouth mirror, get over it. I've got everything else fine. But I will tell you, think of when you're trying to get your luggage ready and going on a trip. You want everything in place. Or ladies, when we're doing our makeup, I like my makeup to be in the exact place because I'm way more efficient when I have my makeup in all the right places and I know exactly where it is. We all have routines that make us more efficient and more effective when we're working through a routine. Your doctor has a routine. They know.
And if you think about it,
go ahead.
Totally. And if you think about it, I'm sorry to interrupt, but if you think about it, there's thousands of things you have to remember to set up a room correctly, right? And if you get 999 of them absolutely correct, and the doctor has this one particular thing that drives him crazy, it's one of his pet peeves, and you don't know it's one of his pet peeves, like the mouth mirror and the Explorer in the lower right-hand corner of the tray. Maybe he told you that one time or twice in passing, but you got 999 things right, but that doctor was still irritated because you forgot that one thing. If you have a checklist of 8 or 10 things that absolutely you cannot miss, and you know those are his pet peeves, you're not going to miss them. Doctor's going to be happy. Now you've gotten 1,000 out of 1,000 things right. But even if you get a 99% on your setups correct, if it's the 1% that drives him nuts every time, you guys are never going to stop having conflict.
Nope, not at all. And they're looking for those little key things. Just like when I look for key things. We all look for key things in our lives. So don't think your doctor's just being snooty. The reality is they're just trying to be efficient. They're looking for those things because that's what makes them the most efficient and effective when they're doing dentistry. So I love this. I love this so much. And dental assistants, I hope you listen in, that you don't roll your eyes and think, oh, these doctors. I hope you really do take it, because this is how you go from your baseline dental assistant to the dental assistant on the A team. There are things, you guys, I have been a dental assistant for 15 years. I feel like I'm a pretty darn good assistant. And I've been told by several doctors, Kiera, you are hands down my favorite dental assistant. Today, if I were to go assist Mark, he might think I'm the worst because it's been a few years since I put the gloves on. But the point is, I think I'm a really good dental assistant, but I even learned things on this from Mark. Like I had never thought of certain things or different checklists or ways that I could make my doctor's life easier. But that is, I believe, what makes a true chairside assistant that your doctor just can't live without. And you really make their lives so much easier. So Mark, I can't thank you enough for just being open of all these different ideas. And shoot, I feel like we only cracked the surface of all your ideas. And so we'll definitely have to do another dental assistant podcast real soon, because I think we just tipped the iceberg on this one.
Yeah, I mean, I was a dental assisting teacher for 11 years. So I think I know a lot of the ins and outs of the actual physical procedures that dental assistants have to know. But from a doctor's perspective, I can kind of guide the dental assistants as far as like those tiny little nuances, those tiny little preferences that doctors have, and how to pull that out of them so that you can be, just like you said, you can be their favorite, and you can really rise to the top and just be an elite level dental assistant for any office that you work for.
Let's be real, dental assistants, it's way more fun to assist than it is to sterilize. So if you want to be in the room all the time instead of sterilizing, here's some tips. And doctors, I hope you are listening as well, of things that you could do to help your dental assistants be set up for success, because I think it goes both ways. And if both are working in tandem, aiming for the same goals, like you mentioned before, Mark, I believe that's that beautiful dance that you're able to have with your doctor and dental assistant. And your patients feel that. They feel how easy it is. They feel the comfort. They feel the fun. And that's what patients are looking for that great experience that they then leave reviews for, they tell their friends about. And it just overall is a better system and process for every single person involved. So as always, Mark, I love when we get a podcast. So thank you again for joining me on the Dental 18 podcast.
Thank you, Kiera.
Take care, guys. Thanks again for joining us, and we'll catch you next time on the Dental 18 podcast. And that wraps it up for another episode of the Dental 18 podcast. Thank you so much for listening, and we'll talk to you next time.